Thank you, Chairwoman DeLauro, Ranking Member Cole, members of the subcommittee. Again, my name is Mark Jenkins, and I'm a service-connected disabled veteran of the U.S. Air Force and founder and executive director of the Connecticut Harm Reduction Alliance. Today, I'm pleased to submit testimony on behalf of the Alliance and as a member of a larger coalition of public health, HIV, viral hepatitis, and harm reduction organizations. First, I would like to thank the subcommittee for the fiscal year 22 funding increase for the CDC's infectious diseases and opioid epidemic program. New funds will help to strengthen services to prevent overdose deaths and infectious diseases transmissions. I'm here today to urge you to provide $150 million for the program in fiscal year 23. Such funding would expand access to overdose prevention and syringe services programs, or SSPs, which save lives and connect people urgently to needed care, including treatment for substance use disorders. Founded in 2014, the Connecticut Harm Reduction Alliance offers a wide range of services to help people who use drugs avoid overdose and live longer, healthier lives. We meet folks where they're at in their time, place, language, and lived experience. Services we provide include syringe services programs to help prevent HIV, viral hepatitis, endocarditis, which is a heart infection, and other infectious diseases. Naloxone, a drug that reverses opioid overdose, and overdose prevention trainings. HIV and hepatitis C screenings, shelter, housing referrals, COVID vaccinations, and referrals and transport to treatment for substance use disorders. We reach, quite a lot of individuals, and last year we engaged approximately 3,500 participants, distributed over 4,200 doses of naloxone, and saved lives, many lives, reversing over 300 overdoses. Our staff works to build relationships based on trust and non-judgmental respect. In Connecticut, there were 1,550 deaths due to overdose in the year 2021, an 11.9% increase over 2020. This is a 20% higher increase than the nation over the same period. The U.S. overdose crisis is a true public health emergency where nearly 108,000 people died last year from overdose, a 74% increase over 2015, and deaths continue to rise in 2022. In both Connecticut and the U.S., overdose deaths have increased, most among Black people and community of colors. Our work must end these disparities and effectively prevent overdose deaths. Now, sadly, because of this crisis, both nationally and in Connecticut, we have insufficient access to syringe service programs. The Alliance has become the state's largest distributor of sterile syringes, yet demand has outpaced supply, especially since funding for SSPs in Connecticut has remained the same while demand for life-saving services has skyrocketed. The CDC's infectious diseases and opioid prevention program is the ideal place for Congress to appropriate funding to expand access to SSPs and prevent overdose. CDC is the nation's expert on SSPs, and with additional funding, it could expand access to these critical services. In fact, new recipients of SSP services are 5 times more likely to reach and enter drug treatment. Studies also confirm that SSPs do not increase illicit drug use or crime, and that they save both lives and money. Now, while Congress has, funded drug prevention and treatment programs until recently, almost no federal funding supported programs that work directly with people that use drugs to help reduce the harms. On April 6th, I celebrated 25 years free from the active, chaotic use of substances that separated me from my family and community. Today, I'm a well-respected, productive member of my community as a result of these very services. I ask that you consider the work that really needs to be done in allowing these services to come forward. Thank you so much for your time and consideration of this urgent request. Please do not hesitate to contact me if you have any questions.